Have you ever felt your heart tighten when you hear the words sudden death, even before you know what they truly mean? One of my patients once shared that a single headline stayed with her all night, not because she was ill, but because the phrase itself felt frightening. I want you to imagine this for a moment. A quiet evening at home, the television murmuring in the background, and a question rising gently in your mind about what is real risk and what is simply noise. I am Dr. Evelyn Carter, and for many years I have cared for older adults and supported families through moments of uncertainty. When people hear about Nipah virus, especially alongside words like sudden death, worry can arrive quickly. The truth is more measured. Nipah virus is rare, and conversations about risk are not predictions. They are careful discussions meant to keep medical systems prepared, not to place families on alert. From long clinical experience, I have learned that fear often causes more strain than the condition being discussed. Our bodies respond to emotional tone. When information feels rushed or dramatic, sleep can suffer, routines can shift, and anxiety can quietly grow. This is especially true for older adults and for those living with memory changes, where emotional safety supports both comfort and clarity. When doctors talk about risk, we are speaking about possibility within context, not certainty. What doctors know comes from observation, patterns, and preparation. It is about readiness, not hidden danger. Calm explanations help protect routine and preserve dignity. They allow the body to feel supported rather than threatened. This video is here to help you understand risk without expecting tragedy. Understanding brings steadiness. It helps seniors and caregivers breathe more easily and trust the body instead of fearing it. Science shows that calm understanding lowers stress and supports better decision-making, especially as we age. If this approach feels helpful, please take a moment to like this video, share it with someone you care about, and subscribe to Senior Health Daily. Your support helps us continue offering calm, trustworthy guidance made especially for you. In the next part, we will gently explore why certain phrases trigger fear and how doctors actually think about risk. For now, let your shoulders soften. You are here to understand, not to worry. And understanding, when shared with care, brings peace. Why the phrase sudden death creates fear. When people hear the word sudden death, the body often reacts before the mind has time to understand. I have seen this many times in exam rooms and living rooms alike. A phrase appears in a headline or a conversation, and the heart tightens. Breathing becomes shallow. Sleep that night is lighter. This reaction is not weakness. It is how the human brain is designed to protect us when it senses danger, even if that danger is not clearly defined. Our brains dislike uncertainty more than they dislike facts. When a phrase sounds absolute and final, the mind fills in the blanks. It imagines outcomes without context. For older adults, especially those who already live with anxiety or memory changes, this kind of language can feel overwhelming. The emotional centers of the brain respond quickly, while the reasoning centers take longer to catch up. That gap is where fear settles in. In medical settings, we use serious language to communicate clearly with one another. Words like sudden are meant to describe timing, not inevitability. They help doctors stay alert and prepared. Outside of that context, the same words can feel frightening. I have often told families that a word can carry weight without carrying truth on its own. Meaning comes from explanation, not from the phrase itself. From a caregiving perspective, I have learned that emotional safety is just as important as physical care. When fear enters the room, routines are disrupted, meals are skipped, sleep becomes restless. For someone living with dementia, emotional distress can increase confusion and agitation. Calm explanations help the nervous system settle. When the nervous system settles, the body follows. Simple science supports this. Stress hormones rise when the brain perceives threat. Over time, elevated stress affects blood pressure, immune response, and memory. This is why understanding matters. Facts placed gently into context can lower stress and restore a sense of control. Control does not mean predicting the future. It means feeling steady in the present. As doctors, we are trained to think in patterns and probabilities, not single words. A phrase like sudden death does not stand alone in our minds. It sits among data, timelines, and real-world likelihoods. When families are given that fuller picture, fear often softens. Questions become clearer. Breathing slows. This is why this conversation matters. Not to dismiss concern, but to replace uncertainty with understanding. When language is explained with care, it loses its sharp edges. Seniors and caregivers can return to their routines, their patience, and their sense of dignity. That steadiness is a form of protection in itself. And it is something we can nurture together, gently and thoughtfully, here at Senior Health Daily. How doctors understand risk. When doctors talk about risk, we are not picturing a single frightening outcome. We are looking at a wide landscape of information and asking how likely something is to occur within a real human life. Risk, in medicine, is about probability, patterns, and context. It is not about predicting the future. It is about understanding what usually happens, what rarely happens, and how to care for people in the space between those 2 points. In everyday practice, clinicians learn to step back from worst-case thinking. A single symptom, a single headline, or a single word does not tell the whole story. We watch how things unfold over time. We look for changes rather than isolated moments. We consider age, overall health, daily routine, emotional state, and the quiet signals the body gives when something truly needs attention. This approach protects patients from unnecessary alarm and helps preserve trust. Probability is a gentle concept when it is explained well. It means asking how often something occurs among many people, not whether it could happen to one person. Many things are possible in theory, but very few are likely in real life. In medicine, we plan for rare outcomes so we are prepared, not because we expect them. Preparation is an act of care, not a sign of danger. Patterns matter deeply to clinicians. When risk is real, it tends to show itself through clusters of signs, changes in function, or disruptions in routine. A body that is struggling often whispers before it shouts. This is especially true for older adults. Subtle shifts in energy, appetite, sleep, or mood often tell us more than dramatic language ever could. Doctors are trained to listen for those whispers. Context is what turns information into understanding. The same word can mean very different things depending on who is speaking, why it is being said, and to whom. In medical discussions, strong language helps teams stay alert. For families, that same language needs translation. Without context, it can feel heavy and personal. With context, it becomes manageable and less threatening. From years of caring for seniors, I have seen how reassuring it is when families understand this difference. They stop bracing for disaster and start paying attention to what truly supports health. They protect routine. They reduce stress. They respond thoughtfully instead of reactively. This steadiness is especially important for those living with memory changes, where emotional tone shapes daily well-being. Understanding how doctors think about risk allows seniors and caregivers to feel included rather than alarmed. It replaces vague worry with grounded awareness. When risk is understood as part of a larger picture, it loses its power to disrupt peace. And peace, as we age, is not a luxury. It is a vital part of staying well. This calm way of seeing risk is something we will continue to explore together here at Senior Health Daily. Nipah Virus and severe outcomes. Explained calmly, when the words severe outcomes are mentioned in medical conversations, it is natural for the mind to tense. I want to slow this moment down and gently explain what that phrase truly means when doctors use it. In medicine, severe does not describe a feeling. It describes a level of attention. It is a way for healthcare teams to signal that a condition deserves careful monitoring, not a way to predict what will happen to any one person. With Nipah virus, doctors talk about severe outcomes because the illness has been observed, in rare circumstances, to affect vital systems in the body. That observation comes from studying past cases and learning how the virus behaves in different settings. It does not mean that severe illness is common, expected, or likely for most people. It means that when doctors see certain patterns, they know how to respond thoughtfully and quickly. In clinical practice, we separate possibility from probability. Many conditions have severe potential outcomes in theory, yet most people never experience them. This distinction matters greatly for emotional safety, especially for older adults. When information is presented without this context, the mind may jump ahead to conclusions that are not supported by real-world likelihood. Doctors are trained to watch for combinations of changes rather than single alarming ideas. Severe outcomes are usually discussed alongside timelines, overall health, and the presence or absence of other stressors on the body. For seniors, factors such as rest, hydration, emotional calm, and continuity of care often play a larger role in day-to-day well-being than rare medical events. I have often reassured families that the body communicates clearly when it needs help. It does so through changes that unfold gradually, not suddenly without warning. This is why routine matters so much. Familiar schedules, regular meals, gentle movement, and emotional reassurance help the body remain resilient. For someone living with dementia, this stability is especially protective. When the environment feels safe, the body copes better with uncertainty. From a scientific perspective, stress is one of the strongest disruptors of health in later life. When fear takes hold, stress hormones rise, sleep becomes fragile, and confusion can increase. Calm explanations reduce this cascade. They allow the nervous system to settle, which supports immune balance and cognitive clarity. This is not abstract theory. It is something I have witnessed again and again in real caregiving settings. Understanding severe outcomes as a medical planning term rather than a personal prediction changes everything. It shifts the focus from fear to preparedness, from alarm to understanding. Families feel steadier, seniors feel respected rather than threatened. Health conversations become quieter and more humane. This is the heart of what we are doing together. We are learning how to hold information gently without letting it disturb peace. That calm understanding supports dignity, patience, and trust in the body as it ages. And it is exactly the kind of care we continue to nurture here at Senior Health Daily. Why older adults are mentioned more often. When older adults are mentioned more often in health conversations, it can feel personal. I want to gently explain why this happens and why attention does not equal danger. In medicine, age is not a warning label, it is a context. It helps clinicians understand how the body may respond so care can be tailored with patience and respect. As we age, the body becomes wiser but also more deliberate. Healing can take a little longer. The immune system may respond differently to stress, infection, or disruption in routine. This does not mean the body is fragile. It means the body values consistency. Regular sleep, familiar meals, steady hydration, and calm emotional surroundings become even more important. When doctors mention older adults, they are acknowledging these needs, not predicting harm. I have cared for many seniors who were remarkably resilient when their days were predictable and their worries were few. I have also seen how quickly confusion or fatigue can appear when routines are interrupted, or when fear enters the room. This is especially true for those living with memory changes. Emotional tone matters. A calm explanation can support clarity, while alarming language can unsettle even a strong body. Age-related physiology is often misunderstood. The heart, lungs, and brain continue to work well when they are supported. What they do not tolerate as easily is chronic stress. Stress hormones can rise more quickly and linger longer. Over time, this affects sleep, blood pressure, and mood. That is why doctors focus so much on reassurance and steady care for older adults. Attention is a form of protection. When medical discussions highlight seniors, it is usually because careful observation helps prevent problems rather than create them. Doctors watch trends over time. They notice small changes and respond early. This approach keeps people well. It does not mean something is expected to go wrong. It means someone is paying attention in a thoughtful way. Families sometimes tell me that hearing their loved one mentioned makes them anxious. I remind them that medicine works best when it is proactive and gentle. Mentioning age allows care teams to slow down, communicate clearly, and respect dignity. It encourages conversations that include caregivers and honor lived experience. In practical terms, this attention translates into simple, supportive actions: keeping routines steady, encouraging rest, offering reassurance instead of urgency. These choices help the body feel safe. When the body feels safe, it functions better. Understanding why older adults are discussed more often can ease worry. It reframes attention as care rather than concern. It helps families and seniors feel seen and supported, not singled out. This perspective allows health information to sit quietly in the background while daily life remains grounded and calm. That balance is essential as we age, and it is something we continue to nurture together at Senior Health Daily. Why older adults are mentioned more often. When older adults are mentioned more often in health conversations, it can feel personal. I want to gently explain why this happens and why attention does not equal danger. In medicine, age is not a warning label, it is a context. It helps clinicians understand how the body may respond so care can be tailored with patience and respect. As we age, the body becomes wiser but also more deliberate. Healing can take a little longer. The immune system may respond differently to stress, infection, or disruption in routine. This does not mean the body is fragile. It means the body values consistency. Regular sleep, familiar meals, steady hydration, and calm emotional surroundings become even more important. When doctors mention older adults, they are acknowledging these needs, not predicting harm. I have cared for many seniors who were remarkably resilient when their days were predictable and their worries were few. I have also seen how quickly confusion or fatigue can appear when routines are interrupted or when fear enters the room. This is especially true for those living with memory changes. Emotional tone matters. A calm explanation can support clarity, while alarming language can unsettle even a strong body. Age-related physiology is often misunderstood. The heart, lungs, and brain continue to work well when they are supported. What they do not tolerate as easily is chronic stress. Stress hormones can rise more quickly and linger longer. Over time, this affects sleep, blood pressure, and mood. That is why doctors focus so much on reassurance and steady care for older adults. Attention is a form of protection. When medical discussions highlight seniors, it is usually because careful observation helps prevent problems rather than create them. Doctors watch trends over time. They notice small changes and respond early. This approach keeps people well. It does not mean something is expected to go wrong. It means someone is paying attention in a thoughtful way. Families sometimes tell me that hearing their loved one mentioned makes them anxious. I remind them that medicine works best when it is proactive and gentle. Mentioning age allows care teams to slow down, communicate clearly, and respect dignity. It encourages conversations that include caregivers and honor lived experience. In practical terms, this attention translates into simple, supportive actions: keeping routines steady, encouraging rest, offering reassurance instead of urgency. These choices help the body feel safe. When the body feels safe, it functions better. Understanding why older adults are discussed more often can ease worry. It reframes attention as care rather than concern. It helps families and seniors feel seen and supported, not singled out. This perspective allows health information to sit quietly in the background while daily life remains grounded and calm. That balance is essential as we age, and it is something we continue to nurture together at Senior Health Daily. What actually protects senior health? When families worry about rare infections, I often gently guide the conversation back to what protects senior health every single day. Over many years of caregiving, I have learned that the strongest protection for older adults is not constant vigilance. It is stability. The body ages best when it knows what to expect and feels emotionally safe. Sleep is one of the most powerful healers we have. Regular sleep supports memory, balance, mood, and immune function. When worry interrupts sleep, the body pays a quiet price. I have seen seniors become more confused, more irritable, and more fatigued, simply because fear kept them awake. Protecting sleep means protecting health. A calm evening routine, familiar surroundings, and reassurance before bed do more good than any late night searching for answers. Routine is another quiet guardian of health. Predictable meals, gentle movement at the same time each day, and familiar social rhythms help the nervous system stay settled. For someone living with dementia, routine is not a preference, it is a foundation. When the day flows in a familiar pattern, the brain works less to orient itself and has more energy for connection and comfort. Emotional safety is often overlooked, yet it shapes physical well-being in profound ways. The body responds to how safe it feels. When conversations are calm and explanations are gentle, stress hormones remain lower. Blood pressure stays steadier. Breathing is easier. When fear enters the room, the body tightens. Over time, that tension can affect appetite, digestion, and immunity. Emotional safety is not softness. It is sound medical care. Reduced stress matters more than many people realize. Chronic stress wears on the heart and the mind. It makes the immune system less efficient and memory more fragile. In contrast, calm understanding strengthens resilience. Seniors who feel reassured tend to recover better from ordinary illnesses and cope more effectively with change. This is something I have witnessed repeatedly in both clinical settings and homes. Rare infections are discussed in medicine so systems can remain prepared. They are not what most seniors encounter in daily life. What seniors do encounter every day is the tone of conversations around them, the predictability of their routines, and the quality of their rest. These elements shape health far more consistently than uncommon risks. Protecting senior health means choosing steadiness over alarm. It means honoring the body's need for rhythm and reassurance. When families focus on sleep, routine, emotional safety, and stress reduction, they are already doing the most important work of caregiving. This understanding allows seniors to live with dignity and confidence. It allows caregivers to breathe more easily. And it reminds us that health, especially in later years, grows best in an atmosphere of calm. That is the kind of care we continue to support together here at Senior Health Daily. As we move through this conversation together, I want to pause in a quiet way and reflect on why understanding matters so much. Over the years, I have watched how knowledge, when offered gently, can soften worry rather than sharpen it. When people understand what they are hearing, their shoulders relax, their breathing slows, the body feels less on guard. This calm state is not passive. It is where good health decisions begin. Many older adults tell me that they feel tired of loud health messages. They are not looking for more warnings. They are looking for steadiness. They want to know how to live their days with confidence and dignity. That is why these conversations are shaped the way they are here. We talk about serious topics without urgency. We allow space for reflection. We respect the wisdom of the body and the lived experience of aging. Caregiving is often quiet work. It happens in kitchens, living rooms, and bedside chairs. It is built on patience and routine. When caregivers feel informed but not alarmed, they bring a calmer presence into those spaces. That presence matters. It supports emotional safety for seniors, especially those living with memory changes, who respond deeply to tone and rhythm. Calm voices and familiar patterns help the brain feel anchored. This sense of community is important to me. I believe health education should feel like a conversation, not a broadcast. It should meet people where they are and walk alongside them. That is why this space exists. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. Sharing this kind of information is not about spreading worry. It is about offering reassurance to someone who may need it. A simple click or a quiet share can help another family feel less alone. It can help a caregiver feel more confident. It can help an older adult feel seen and respected. As we continue, remember that learning does not require urgency. You do not need to hold everything at once. Take what feels useful and let the rest pass by. Health is not built in moments of fear. It is built slowly through understanding, routine, and compassion. Thank you for being here and for choosing to learn in a way that honors calm and dignity. This shared steadiness is what allows health conversations to heal rather than unsettle, and it is something we will continue to nurture together at Senior Health Daily. How families should think about risk. Families often ask me how to know when concern is appropriate and when calm observation is the healthier choice. This is a thoughtful question, and it comes from care, not fear. In my experience, the most helpful approach is to remember that risk in medicine is rarely an emergency on its own. It becomes meaningful when it shows itself through changes over time. Concern is appropriate when there is a clear shift from what is normal for a person. This might be a change in energy that lasts, confusion that is new or worsening, or a disruption in routine that does not settle with rest and reassurance. These kinds of changes invite gentle attention and conversation with a healthcare provider. They do not require panic. They require presence. Calm observation is healthier when information feels abstract or distant. Headlines, statistics, and generalized warnings are not signals that something is happening inside a specific body. For older adults, reacting to every new piece of information can create constant tension. That tension often causes more discomfort than the risk itself. Calm observation allows the body and mind to remain steady while staying aware. I often remind families that the body is an excellent communicator. It tends to ask for help in small, repeated ways before it needs urgent attention. Paying attention to daily patterns is far more useful than scanning for rare outcomes. How is sleep? Is appetite steady? Does the person feel oriented and emotionally settled? These questions tell us more about health than any isolated word or phrase. For those living with memory changes, emotional tone matters deeply. When caregivers respond with calm curiosity rather than alarm, the person feels safer. Safety supports clarity. Clarity supports cooperation and comfort. This approach preserves dignity and reduces distress for everyone involved. Thinking about risk also means trusting routine. Routine is a form of quiet monitoring. When routines are consistent, changes stand out naturally. There is no need to watch constantly. The body will show you when something is different. This allows families to live their lives without feeling on edge. From a medical perspective, we encourage families to partner with healthcare providers rather than carry worry alone. Asking questions when something truly feels different is wise. Holding space for uncertainty without rushing to conclusions is equally wise. Both can exist together. Understanding how to think about risk gives families confidence. Confidence softens fear. It replaces constant scanning with attentive presence. This balance allows seniors to feel supported without feeling scrutinized. It allows caregivers to remain patient and grounded. When families learn to distinguish between information that needs action and information that simply needs understanding, daily life becomes calmer. That calm is not denial. It is a thoughtful response shaped by care, respect, and trust in the body. And it is one of the most valuable gifts families can offer as they walk alongside aging loved ones here at Senior Health Daily. Many families believe that safety comes from constant monitoring. I understand where that belief comes from. When we care deeply, we want to stay alert at all times. Yet over the years, I have seen how hypervigilance quietly increases stress for both seniors and caregivers, often without improving health. True safety, especially in later life, grows from consistency rather than constant checking. When the body feels watched every moment, it does not feel protected. It feels tense. Older adults, and particularly those living with memory changes, are sensitive to emotional cues. Frequent questioning, repeated checks, or anxious observation can create a sense that something is wrong, even when it is not. This can lead to restlessness, disrupted sleep, and increased confusion. The intention is care, but the effect can be distress. Consistency creates a different kind of safety: regular meals at familiar times, a steady bedtime routine, gentle movement woven into the day, familiar faces and calm voices. These patterns tell the nervous system that it is safe to rest. When the nervous system rests, the body functions more smoothly. Blood pressure steadies. Breathing deepens. The mind becomes clearer. In dementia care, this principle is especially important. The brain works best when it can rely on rhythm rather than vigilance. Constant monitoring can overwhelm cognitive reserves. Consistent routines conserve them. This is not about doing less. It is about doing what matters most with intention and calm. From a clinical perspective, meaningful changes stand out more clearly against a stable background. When life is consistent, a true change in health becomes easier to notice. Hypervigilance blurs this clarity. Everything begins to feel urgent. Nothing feels certain. Consistency allows caregivers to trust their observations and respond thoughtfully when needed. I often encourage families to think of safety as a quiet presence rather than an active search. Being nearby, being attentive, being available. These qualities support dignity and autonomy. They allow older adults to feel respected rather than monitored. Respect supports cooperation. Cooperation supports well-being. There is also a physical cost to constant stress. Chronic alertness raises stress hormones, which affect sleep, immunity, and mood. Over time, this can weaken resilience rather than strengthen it. Calm routines lower stress naturally. They support the body's ability to cope with everyday challenges. Safety without hypervigilance means choosing steadiness over surveillance. It means trusting routine as a form of care. It allows families to breathe and seniors to relax into their days. This kind of safety does not demand constant attention. It grows quietly through patience, familiarity, and emotional ease. When caregivers embrace consistency, they often notice something surprising. Everyone feels better. The home feels calmer. Decisions feel clearer. And health becomes something lived gently rather than watched anxiously. This balance is an essential part of dignified aging, and it is one we continue to support together at Senior Health Daily. Awareness without alarm. Awareness is a quiet form of strength. Alarm is loud and exhausting. One of the most important lessons I have learned in caring for older adults is how different these two states truly are, even though they are often confused with one another. Being informed means understanding what matters and letting the rest settle. Being anxious means feeling constantly on edge, as though something must be done right now, even when there is no clear action to take. Simple science helps us understand this difference. When the brain senses threat, it activates a stress response. Heart rate rises, breathing becomes shallow, muscles tighten. This response is useful when danger is immediate. It is not helpful when the information we are processing is general or theoretical. Prolonged stress without action keeps the body in a state of alert that wears down resilience over time. Awareness, on the other hand, engages the thinking parts of the brain. It allows information to be processed calmly and stored appropriately. When people understand what they are hearing, the brain does not need to stay on guard. Stress hormones remain lower, sleep improves, memory functions more smoothly. This is especially important for seniors and for those living with cognitive changes, whose nervous systems are more sensitive to emotional tone. In clinical settings, we encourage awareness without alarm because it supports better decisions. When people are anxious, they tend to overreact or freeze. When they are informed, they ask clearer questions and notice meaningful changes more accurately. This leads to timely care when it is truly needed and patience when it is not. I often tell families that awareness lives in the background. It does not demand constant attention. It quietly supports routine. It allows daily life to continue without interruption. Alarm lives in the foreground. It interrupts meals, sleep, and conversation. Over time, it can become more harmful than the risk it is reacting to. From a caregiving perspective, calm awareness creates a safer environment. Seniors feel steadier when those around them are composed. This steadiness supports dignity and cooperation. It allows older adults to remain engaged in their lives rather than feeling defined by potential problems. Science also shows that calm states support immune balance and cardiovascular health. The body repairs itself more effectively when it is not under constant stress. Awareness without alarm is not a passive stance. It is an active choice to process information thoughtfully and respond when appropriate. Learning to hold information this way takes practice. It begins with understanding and grows with reassurance. Over time, families find that fear loses its grip. Confidence takes its place. This shift allows health information to serve its true purpose, which is to support well-being rather than disrupt it. This gentle balance between awareness and calm is something we can cultivate together. It honors the needs of aging bodies and minds and keeps health conversations humane and steady. That is the kind of understanding we continue to build here at Senior Health Daily. How understanding builds confidence. When fear begins to loosen its grip, something quiet and powerful takes its place. Confidence. I have watched this transformation many times in families who care for older loved ones. At first, worry fills the space. Questions feel urgent. Every piece of information feels heavy. Then, as understanding grows, the atmosphere changes. Voices soften. Movements slow. Decisions become clearer. Understanding does not mean knowing everything. It means knowing enough to feel steady. When families understand how doctors think about risk, how the body signals true change, and how routine supports health, they stop reacting to every new word they hear. They begin to trust their observations. They notice patterns rather than isolated moments. This shift brings a deep sense of calm. Confidence supports patience. Caregivers who feel informed are less likely to rush or push. They give older adults time to respond, to rest, and to remain involved in their own care. This patience is especially important for those living with memory changes. A calm, confident caregiver creates a safe emotional environment. That safety allows the person to function at their best. I have seen how understanding improves communication. Families ask more thoughtful questions. They listen more closely to healthcare providers. Appointments feel less stressful and more collaborative. Instead of bracing for bad news, families approach care as a shared effort focused on well-being. This partnership leads to better experiences for everyone involved. Confidence also protects routine. When fear fades, daily rhythms return. Meals are enjoyed, sleep becomes more restful, gentle activities resume. These simple moments are not small. They are the fabric of quality of life in later years. Maintaining them supports physical health, emotional balance, and dignity. From a medical perspective, confident caregivers are often more effective. They recognize when something truly needs attention and when reassurance is enough. This discernment prevents unnecessary stress and allows timely care when it is genuinely needed. It is a skill that grows with understanding and experience. For seniors, being cared for by confident, calm family members makes a profound difference. They feel less like a problem to be solved and more like a person to be honored. Respect deepens. Trust grows. The home becomes a place of comfort rather than vigilance. This is the quiet gift of understanding. It replaces vague fear with grounded awareness. It allows families to move through uncertainty with grace rather than tension. Over time, confidence becomes a steady companion, guiding care with kindness and clarity. As we close this part of the journey, remember that understanding is not about eliminating all worry. It is about giving worry less control. When understanding leads, care becomes gentler and more effective. This is the kind of caregiving that supports dignity and peace, and it is what we continue to cultivate together at Senior Health Daily. Thank you for staying with me through this conversation and for giving yourself the time to listen. Simply being here and choosing to understand is already an act of care. Learning about risk does not mean you are waiting for something to go wrong. It means you are allowing clarity to take the place of worry. When understanding arrives, fear no longer needs to lead. Over many years of caring for older adults, I have learned a simple truth. The aging body responds best when it feels safe, respected, and unhurried. It does not thrive under pressure or constant alertness. Emotional safety allows the nervous system to settle. When the nervous system settles, the body becomes more resilient. Sleep improves, breathing deepens, the mind feels steadier. These quiet changes support health in ways that headlines never mention. Routine is another form of care. Familiar rhythms protect dignity and comfort. They help the body know what to expect and conserve energy for what matters most. When routine is honored, seniors feel grounded rather than fragile. Caregiving becomes gentler. Patience comes more easily. Trust grows on both sides. Understanding risk and context is part of this gentleness. It allows you to stay informed without feeling burdened. It reminds you that preparation is not the same as prediction. Awareness does not require alarm. Calm understanding supports better decisions and a more peaceful daily life. As we close, I want you to carry this sense of steadiness with you. There is nothing you need to fix right now. There is nothing you need to watch for tonight. You can return to your day or your evening knowing that you are informed and supported. Senior Health Daily is here as a quiet place to return when health information feels too loud. There is no urgency and no pressure. Just steady companionship, thoughtful guidance, and respect for the journey of aging. Whenever you need calm reassurance, you are always welcome here.